you. Senator Scott?
Ms. Bliss, do you have any information suggesting that those numbers are right?
I cannot validate those numbers. I don't have any reason to believe they're not.
But you have no indication either way, actually.
I have no basis for
So
knowing.
if I tell you
Sure.
that the number is 30 million, that you have no reason to believe that it's not 30 million.
I don't have a basis for validating that number. Our case study did no, oh, I'm sorry.
Thank you, ma'am. That's great. Mr. Bagadon, our ranking member asked you several questions about fraud, and I certainly understand and appreciate why so many Americans look at this process and become disenchanted. Your objective was never to figure out how much fraud was in the system. Your objective appeared to me to be to show us how fraud could happen. Is that accurate?
Yeah, essentially, Senator, you're correct. The big picture we're looking at is any vulnerabilities in the controls that are in place, and also for any indicators of potential fraud that pop up. For example, our ability to circumvent the controls we encountered during our undercover work. We did that for 2014, and we repeated that experience in 2015, which case we were successful 17 out of 18 attempts. Now, I would have to caution that, of course, and further to the point that Senator Coates made earlier, that is not a projectable number. So we have to be very careful that that doesn't represent the actual universe. That is just a data set that we use to continue our work in this area.
Yes, thank you very much. No one's going to mistake me for a fan of Obamacare or the ACA without any question. For a number of reasons, I'm not a fan of the website nor the actual policy itself, the legislation. I think of the Independent Payment Advisory Board, what some have referred to as a death panel, the ability to ration care to the future. This is one of the classic examples why so few Americans have the same appreciation that others have talked about of the ACA. Think about the fact that we're talking about taxing Americans, whether it's their income or their profits, an additional 3.8% tax, raising somewhere over $120 billion. Another reason why so few Americans have the same positive opinion that we've heard from some of our friends on the other side. Think about the whole notion of how the healthcare law is going to regulate the posting of calories at pizza parlors, grocery stores, all over the place, and by default increasing the price of these groceries, these pizzas, and other non-food items. Reducing the number of employees' hours, talking about the impact on middle-income America, so many Americans losing perhaps up to 25% of their income because of the ACA. We can see why, as so many Americans have found themselves frustrated with where we are with the ACA, that it's not old news to them. It's not old news, actually, when you think about the fact that so many Americans are facing higher premiums. We've heard so many different numbers this morning. We know that at least some states have seen an increase of more than 25% of their health care cost. 2 states have seen those numbers go over 35%. Those are real dollars for struggling Americans who cannot afford the cost of health insurance. And not only are the premiums higher, the deductibles are higher. The out-of-pocket expenses are higher. The only thing that's actually lower are the doctors to choose from and the hospitals to go to. We've seen a catastrophic occurrence under this health care law. And even at one of the most recent Democrat town halls, a young lady who supported President Obama, who supports the health care law, said that her premiums had doubled, tripled. Her concerns were strong, clear. Here's one real case example that, Ms. Bliss, I hope is no longer happening. A young man named Tom Dougal from Elgin, South Carolina, who created an account on healthcare.gov, was called shortly thereafter by a man named Mr. Dougal, from a guy named Mr. Justin Hadley from North Carolina, who had done the exact same thing, gone online to the healthcare.gov, and created an account. But what he found populating his account was information from Mr. Dougal. He called HHS and could not get any assistance. Finally, they called our office, and during one of the hearings, we were able to get that situation solved, or at least the beginning of that situation solved. Can you guarantee me that that situation is no longer occurring anywhere within healthcare.gov?
I cannot guarantee that. We've overseen and conducted reviews of the controls to ensure that both the website and other parts of the program and identity verification, eligibility verification are working properly. But we have raised concerns about some flaws or weaknesses in those controls, similar to GAO, and I can't make that guarantee. But we're certainly working hard to identify where there's a vulnerability of that happening and make recommendations on how to improve it.
My last question, since I'm out of time so quickly here today, back to you, Ms. Bliss, is that it appeared that as we've celebrated the success of improving the system in the first couple of months, I will note a new $1 trillion program. One of the recommendations was for clear leadership. Earth-shattering. Thank you.